By Friday, 14th February 2025, 107 patients had successfully undergone surgery at the two county referral hospitals of Siaya and Bondo. The Siaya-Tango surgical camp marked a new chapter in the health sector by bringing patients across the county with complicated cases and yet needy for surgical procedures under one roof of operating theatre performed by professional Canadian doctors from Teiba.
My name is Ryan Torrey, Dr. Ryan Torrey. I'm with the Tango Foundation. I'm a physician from Canada, and we're delighted to be here to work with the physicians and nurses and staff in Siaya County. We are a sister city with Siaya in Taber, Alberta, Canada, and we're delighted to work together and see how we can help each other and learn from each other. We're grateful for the governor and all of his ministers and staff and physicians at the hospital for allowing us to come here and work with them. And we look forward to improving relations over the years and seeing how we can help and have an opportunity to learn from you guys and work well together. So, thank you.
On Sunday, 9th February 2025, the Canadian charitable organization based in the town of Taber in Canada arrived in Siaya County. The team received a warm welcome from the county staffs led by the First Lady of Siaya County, Mrs. Betty Orengo, the County Executive Committee Member for Lands, Mr. Maurice Makorege, and the County Executive Committee Member for Health, Dr. Martin Konyango.
This mission builds on our friendship. Initially the Taber Municipal of Bondo friendship, but now Taber Municipality, Taber and Siaya County. I want to say that on our side, we are really set after those many meetings, virtual ones, a lot of communication, email, we are really set. And the prime reason why you are here, which is to assist our patients and do the surgeries. We are prepared, we have the patients set. I know the next phase after this will now be very technical, will be in the hospital.
This is a journey that I started 2018. When I started this collaboration alone, I didn't know it would reach this level. Now it has passed through so many twists here and there. We started with the irrigation side, the egg side, it twisted to labor exchange, and we are also touched on security. And I think the last time we were here with the mayor in 2018 to sign the memorandum of understanding. But in 2022, I brought the chief of police, and I think we're still dealing with the security side, which I don't want to talk about now.
When we were in the operating room in about 2012 or something, we'd been with a different group. I'd gone overseas multiple times, and there's, anyway, some things happened. It wasn't the greatest, and I was like, I think we can do better in Taber. So in the operating room, Linda Moot, so Michelle, her mom, and Dave Moot, his wife, we were talking in the operating room, and Terry Valgertson, like, we should get something started in Taber. So as a group, we got it started the Society or the Foundation, and it's just kind of grown. My job is very busy,
So a lot of times I'm exhausted and Colleen will text or call like, hey, let's get this going. And Kendall and Jen and everyone just does their little bit to help make these things happen. And so I do a little bit, but it's an amazing team.
Our guests, this is such a beautiful day for us here in this county. We welcome you with love and joy. We cannot believe the day is here. John said a little bit about how the thought germinated. And thank you, John, for remembering that conversation. You know, a lot of times we in county governments host visitors. We have lots and lots of conversations, but not often do those conversations result in something as big as this. For Siaya, this is huge.
Giving does not only precede receiving, it is the reason for it. It is in giving that we receive. The First Lady had the privilege to hand over gifts to the team of doctors from Canada as a welcoming note to Siaya County.
And from Canada, I brought a very special guest in my backpack. And I'm wondering if you would consider adopting this fuzzy animal who wants to relocate from cold, cold Canada to somewhere really warmer. Yeah. And if he's bad, you can give him back to me and I'll take him back.
No chance of that.
Yeah.
The county government of Siaya partnered with TEBA Assisting Nations through global outreach dubbed Tango to leverage on the surgical camp to help eliminate cost barriers, provide specialized medical and surgical services, and boost the capacity of healthcare personnel in Siaya County.
We have two categories of patients who are going to be operated. We have general surgery cases. This involves from pediatrics, females and males with general surgery cases. Then the next category is the OBS gynae cases. This is a separate list, and this is purely female cases.
We're glad we are having a surgical camp from our partners from Canada today. We've mobilized from all the sub-counties of Bondo and Ariada. We've mobilized approximately 56 patients. We started today. Today we've booked in 5 and we have 2 theaters. One is operating gynae cases, OBS and gynae cases down in our other theater. Here we are doing mostly surgical cases.
Operation started off very early in the morning. We were quite timely. The surgeons and the supporting staff, the nurses were here by 7:30. They reviewed the patients, just in addition to what had happened yesterday, confirmed the cases, and set off with the work by 8, 9.
The purpose of the Siaya-Tango Medical and Surgical Camp was to promote strategic partnerships between Siaya County and Tango personnel and healthcare providers towards enhancement of the technical capacity of Siaya Medical for healthy personnel through continuous medical education, offer free medical and surgical services to alleviate existing disease burden in the county, teach basic and specialized surgical and clinical management skills and healthcare personnel in the county, provide the best medical and surgical services to patients, promote access to medical and surgical services otherwise hampered by financial costs.
Koro kanyaromo wachunal kik wacham gimoro the whole day. Amano ne watimo mako chamo gimoro karomo gimo saa 11:30 no kawa tira theater nene ochakna nitie masin mane kelo matin mochakna service gimo sario kano sechak timo osetim na mano chwa ge yath mar kwere askore akochak feel kama nene nitie mane ginene intestines mai ogo makilo na tabu okano setime mano yath no chwa mag kwere ma aduogi fahamu mara saa 8 kaka kora ng'eyo ni kendo an kanyo osetiek na services.
Nyinga mere tieno duor koro nabiro kan kike chiek asebedo ka tuo ka gini rama mawacho ni dok chien moki to koro sudo ka koro nabiro kase pesa sai chanda manyalo biro koro nyogo pok wayudo nini jogi bowachonwa ni wasunge moko biro chieth ka koro nyo waringo matek ogochonwa godhiambo basa biro to gini osebedo karama kachokuodo osonyalo ramo guchani samoro tiendo sa otama nokauth to lweta ni bende no apudho botur koro tapuodho moro kabe be mabe an go malongo be onge ananga man kanyo ko gole anyalo bedo gi thuolo.
Nyinga en Carolina Dhiambo Gamba. Asebedo gi shida mara ani kuom higni malawo 2 lakini kokadho kuom gavana marwa ma Siaya aneno kokelonwa wazunge manyalo chiedhowa kendo waketo geno kuom Nyasaye kendo Nyasaye omed mana miye chuny mar teko mar manyo ne jotuo kaka gichango. Kokalo kuom bidii mare Nyasaye dhi kadho kendo wadhi mana yudo ngima. Wagone erokamano maduong' kuom tich matek mosetiyo.
The patients who benefited from the Siaya-Tango medical and surgical camp expressed gratitude and thanked the professional doctors from Canada and Siaya County for the great work done, which made it possible for them to overcome all the pain they've undergone through their life.
Dr. Evans, I'm the gynecologist in the Bondo Sub-County Hospital in Siaya County. We've actually had a very successful week with the Dr. and his team, and we've gotten to learn a lot from them. They've also learned a few things from us, and at the end of the day, we all leaving this place better doctors. But all this was for the benefit of people of Siaya, people from surrounding counties. Information about this camp went out there. We even had clients from neighboring counties, that's Vihiga, Homa Bay, and with various conditions, fibroids, some with pre-malignant lesions, some with ovarian tumors, and we were able to operate on all these cases. Of course, the need is still out there. Quite a number of patients who still require these services, and even as the team from Canada and the US leaves, we are still around, and for sure we'll keep offering these services, and we get to welcome to Bondo Sub-County Hospital and get to enjoy what we can offer.
Hello, this is Dr. Ryan Torrey. I'm the president of the Tango Foundation. I'm a surgeon here helping out this week. We're doing a surgery camp. Thank you in large part to Governor Jim Arengo and First Lady Betty that they helped make this possible, and the Waziri, Minister of Health. We're so grateful for everyone that helped make this possible. We're grateful for our local surgeons for helping to open up the way to the hospitals that we could come in and help. We're delighted to be here. It's been an amazing week. It's been busy here on this side. We completed 31 surgeries, which is a tremendous effort by all the staff, the nurses, the doctors, the cleaning staff, and the technical workers to help make all this happen. But it's been a phenomenal week. It's been well worth our time to come from Canada, but we are so grateful for the opportunity to come. And we have a wonderful community in Tabor. We are actually sister cities, town of Tabor with Siaya County, And we've had Governor Orengo come to Canada on multiple occasions, and it's such a delight to send a contingency of our surgeons and doctors and professionals that come help make this possible. We brought surgeons and physicians from the United States and Canada, and they've had a phenomenal week. It's been an absolute pleasure and delight to come here and help in any way that we can. We have identified multiple areas that we can assist and collaborate and cooperate with the professionals here and with the administration of Siaya County. So we're delighted to have had this opportunity. It's been amazing to see. The governor mentioned that sometimes the income is less here, but it's unbelievable what the staff do here with what they have. They work extremely hard, they do an amazing job, they're doing unbelievable surgery, and the outcomes are fantastic, and the families are beautiful, and it's been a delight to come here and help, and anything we can do to assist, we're looking forward to doing that in the past. We're hoping to have a long-term relationship, keep coming back on a regular basis, to work with the professionals from Canada to continue to provide support throughout the year. We did identify in our continuing medical education with Dr. Michael at Siaya County Hospital that there are still some health facilities out in the periphery that don't have power, so we're hoping we can help them establish solar power so that they always have power at night if an emergency comes in. Because of that, they don't have a fridge to keep the medicines, critical medications like syntocin or oxytocin to help with postpartum hemorrhage. So we're hoping to help them make sure they have power so they can keep those medicines on hand and help save lives when that occurs. Also, ultrasound is a challenge. They don't have ultrasound currently in the department, and we're hoping that we can help make that happen as soon as possible. Also, things like the fetal Dopplers to be able to easily check the baby's heartbeat. They're currently working with fetoscopy, which works, but it can be very challenging. And we're hoping to help bring that here as quickly as possible to as many facilities as we can and continue to provide support over time. But we are so grateful for Kenya and the welcome. We've traveled all over the world. I won't mention the names of the countries, I don't want to offend anyone, but we've traveled many places around the world, and the reception here in Kenya and Africa has been unbelievable. We have never been received like this in any other country in the world, so thank you.
The Tango Foundation doctors, in collaboration with County Government of Siaya, embarked on a unique cultural tour to the Jaramogi Oginga Odinga Memorial Museum in Nyamira Kango Village in Bondo Sub-County.
The way we are standing in the front of the first wife of Jaramogi Odinga. In our language, we call that one Mikai. So this is now the house of the first wife. So before Jaramogi came here, Jaramogi was living in the other house, but that house was semi-permanent by that time. So by the time Jaramogi was living in a semi-permanent house, Jaramogi was teaching at Maseno. Jaramogi himself was a teacher by profession. So before he ventured in politics, he was teaching.
The purpose of this visit was to familiarize themselves with the Luo cultural sites and traditional practices that were significant during the early years of Kenyan independence.
Jaramogi, who is resting here, was born in 1911 and he died on 20th January 1994 and was laid to rest here on 5th February 1994.
The delegation experienced the rich cultural ambience and gained insights into how historical figures like Jaramogi Oginga Odinga, his son the former Prime Minister Raila Odinga, and Governor James Orengo fought valiantly for Kenya's democracy and the establishment of a multi-party system. The tour also provided the doctors with an understanding of the community's leadership hierarchy.
207 and Raila won, yes, and he refused to leave power. So there was a piece which was led by Anand, who was the secretary of the UN. Right. So that was the government was divided. Yes. So the President Raila Prime Minister, and they were sharing power. Right. So the bulk appointments is not necessarily allows appointments in this.
Oh, I see. Okay. It was really good. It's a nice display, and I learned a lot. Thank you.
So much information. Thank you.
Thank you.
It was
Thank you very much.
no idea. Thank you.
Governor James Orengo, along with doctors from the Tango Foundation, paid a courtesy visit to one of Siaya County's model early childhood development education ECDE Center, Siala Kaduol, located in South Game Ward. The doctors who came from Teiba in Canada were there to observe the educational initiatives spearheaded by the county government of Siaya under Governor Orengo's leadership. Their visit aimed to assess how these initiatives are enhancing the standards of early childhood education within the county.
Vamos,